Dear students, Assalamu alaikum. I welcome you all in the first year MBBS anatomy class. Today I am going to teach you the human anatomy, the gross anatomy. And my first topic is the introduction to general anatomy, the organization and the anatomical terminology. I am Dr. Kalimullah. Anatomy, by definition, is the study of structures and the relation of the structure and the location of structure, as where is the specific structure is lying. In Greek, anatomy is to cut up or the cut open. In Latin, dissection. Dis means apart and sect means to cut. Dissection is not the classification, but it is the procedure by means of which we have an approach toward the anatomy, the study of anatomy. The types of anatomy. Gross anatomy are macroscopic anatomy which we can see by naked eye. The histology are the microscopic anatomy. The developmental anatomy are the embryology, that is the stages of development of human being right from embryo to the adult. Now the regional anatomy. The regional anatomy region-wise, like thorax, head and neck, and upper and lower limb and the abdomen, these are all the regions. In the radiological anatomy, we use the study of anatomy, the knowledge of anatomy toward the radiology purposes. Applied anatomy, where the anatomical knowledge is applied on toward a clinical or an illness, a clinical condition, you may say. The systemic anatomy, you know, all the systems like circulatory, the genitourinary system, the nervous system, and other alls. The surface anatomy, this reveals a thing which is present beneath the skin, and we palpate, we apply touch upon that particular site, and we perceive something that is called the surface anatomy. That is such structure is lying underneath the particular region of our skin. Like we put a stethoscope on the chest, and we heard the heart sounds by putting the stethoscope bell on the heart directly. We cannot say that there is heart lying, but the sounds of the heart tells us that the heart is lying on the left side of the chest. So this is called the surface anatomy. Now the levels of organization, you would have studied in your FEC course that a cell is the functional and structural unit of an individual. Over here we are concerned with human being. That is why we will discuss the in perspective of the human being. Stem cell is the simplest structure, and the combination of various similar cells, they form tissues, and the dissimilar cells they gather and they form an organ which perform a specific function. The organs then in turn they combine to form an organ system, and all the organ system, there are 11 organ systems in the human body. They combine and to form an organism over here, the human body. Tissue is a group of similar cells which perform common function. Different tissue types, they work together to perform a specific complex function. Related organs work together and coordinate the activities and achieve a common function. All body systems function interdependently and a single living thing that is called the organism. Okay, the four types of cells, the epithelial cells, the connective, the muscle tissue and the nervous tissue. We will briefly go through. The epithelial cells, they cover the exposed surfaces and lines the body cavities. That is the example of the skin and the lining of the GIT, the gut, and the other mucosa. Connective tissue protects, supports, and interconnects the body parts and organs. This connective tissue is of three types. The solid type, the example of the solid type is bone. The liquid example is blood, and the intermediate type, the example is a cartilage. The muscle tissue, it produces movements, and these major types of muscle tissues are the skeletal muscle, the smooth muscles, and the cardiac muscles. The nervous tissue conducts the impulses for internal communication. That is it is composed of brain, the spinal cord, and the spinal nerves and the cranial nerves. The body systems. The integumentary system are the skin and the allied structures like the nail, the hairs, and the skin glands. All these are called the integumentary system. The skeletal system, the bones, and the appendicular skeleton, that is the skeleton of the upper and lower limbs, and the axial skeleton are the bones of the thorax and that of the skull. The muscular system, the nervous system, the endocrine system, the cardiovascular system, lymphatic system, respiratory system, digestive system, urinary system, the male and female reproductive system. All these systems we will discuss in due time. Now this is something new for you, anatomical terminology. Some terminologies we will use in the study of anatomy. We will use in term of positions, the planes, the directions, and the movements of the body. Anatomical position. And a human being who is standing upright and having the eyes forward, the toes forward, and the palms looking forward. This is the normal anatomical position. The supine position. In such a position, if we lay down the person on the ground, that is called the supine. And the prone position, if we upside down, the third one, you can say this is called the prone position, and this is the upside down condition. And then the lithotomy position, you can see very well the fourth number picture. These all positions are required for the medical examination and for medical procedures even. In due time you will go through, inshallah. The terms of movements. These are almost paired. One is against the other. For example, the flexion and the extension movement. Flexion movement is simply the reduction of the angle between the two bones. Like we bend our elbow, this is called the flexion, and if we open our elbow, that is called the extension. The abduction, it is very well evident from the name abduction, to take or to take away, the upper or the lower limb from the side of the body. Abduction, adduction toward, movement toward the body. Abduction, movement away from the body, and adduction, movement toward the body. Then the rotation. Rotation, the rotation is of two types then. The medial rotation, for example, the upper limb is stationary, but we move it in circular fashion toward the body, and in circular fashion away from the body. That is called the lateral rotation. Then the circumduction. Circumduction is the movement of the combination of all the above movements. That is the abduction, adduction, extension, and the flexion. Then the protraction. Protraction outward, like we protrude our jaw outside, and we retract our jaw, the mandible, toward the body. Pronation and supination. This is especially brought about in the forehand, because two bones, the radius and the ulna, they ride upon each other and bring about the pronation. That is the palm down and the palm up is called the supination. The eversion and inversion. This is a special movement brought about at the level of the foot. Toward inward movement of the sole of the foot is inversion, and outward movement of the sole of the foot is eversion. Then the dorsiflexion. The dorsiflexion at the ankle joint. At the ankle joint, we flex the foot toward the leg. That is called the dorsiflexion. And the plantar flexion is to movement toward the sole of the foot. Opposition. Opposition movement is only brought about by in the hand toward the thumb. This is called opposition movement. Now the anatomical planes. These are imaginary planes on the surface of the human body. These are three types. The coronal plane, the transverse plane, the sagittal plane, and another is the oblique plane. The coronal plane divides the body simply into an interior and posterior part. जैसे एक अगला और पिछला हिस्सा में उसको बॉडी को तकसीम कर देता है, उसको बोलते हैं कार्नल प्लेन. द ट्रांसवर्स प्लेन, इट डिवाइड्स द बॉडी इन टू upper and lower parts. The sagittal plane, it divides the body into two equal halves, the right and the left. And the oblique plane, tangentially we cut across the body. So these planes are very much important in location and of the organ, and to have an approach toward the specific organ. and look at it. Now the directional terms, describes the position of the structure relative to others are the location in the body. Relative to belly, the are the back. The anterior or the ventral. Toward the front is called the anterior or the frontal. The posterior or the dorsal is toward the back. Relative to midline or center of the body. These are the medial toward the midline of the body and lateral away from the midline of the body. Deep on inside underneath the other structures, that is called deep. And superficial is away from the deep toward the surface of the body is superficial. Relative to the point of attachment of appendage. Appendage means the upper and the lower limb, the appendicular skeleton. The structure is made up of the appendicular skeleton. The proximal means the upper, which is closest to the point of attachment to the trunk, and the distal, which is away from the point of attachment, like our upper limb is attached to the at the shoulder to the side of the trunk, and our palm is away. Our palm is distal and our shoulder is proximal. It is also called the superior and the inferior. In these three diagrams, you can see the appendicular skeleton and the axial skeleton. The appendicular skeleton is skeleton of the upper and the lower limb bones, and the axial skeleton is the bones of the skull, the thoracic region, and the vertebral column. And in this particular the skull bone picture, you can see the two aspects, the rostral aspect and the caudal aspect. The rostral aspect is toward the frontal bone, and the caudal aspect is toward the base of the skull. Then another term, the palmar aspect and the dorsal aspect, we can see in the palm of the hand. So it was all about your introductory class, and we will meet again and again in due time. God may bless you all. Thank you.